In this, our second series, we welcome members of the Movement for Health Coalition to showcase the work achieved by Scotland's charity sector, supporting people with long-term health conditions to move, celebrate their movement, and evidence the need for more investment.
Hello and welcome to the Movement for Health podcast, Movement in Conversations. This is series 2, where we look at how our members move, looking at the Movement for Health Coalition membership organisations and how they're supporting people living with long-term health conditions to move more across Scotland. I'm delighted to be joined today by Kieran Scott, who is the Head of Communications at Change Mental Health. Good morning, Kieran. Lovely to see you this morning.
Good morning. Thank you very much for having me.
Great, thanks for joining. We're going to kick off, Kieran, with a discussion about mental health in Scotland and specifically Change Mental Health as an organisation. Tell us a little bit about what you guys do and who you support.
Sure, yeah. So Change Mental Health, national mental health charity. We've been on the go for nearly 53 years. We started as the National Schizophrenia Fellowship. We came about because of a letter that was written in the Times from a father whose son was experiencing schizophrenia and the challenges that occurred through caring responsibilities. Many carers rallied to support. They became members. We're a membership organisation still to this day. That formed the fellowship. Charity split into its devolved arms. Thereafter, we became an independent charity in 1984. But since then, we've evolved to supporting people affected by severe and enduring mental illness. So that's delivering non-clinical and person-centred support in communities across Scotland. Our vision is a future where no one needs to face mental illness alone. We're here to provide transformational support, ensuring that everyone has access to the support they need when they need it in a way which works best for them. We seek to change society by changing attitudes, fighting stigma, and influencing government to ensure a better quality of life for those affected by mental illness. We support over 10,000 people a year across Scotland. We deliver support in regions all the way from the top of Highland to the bottom of Dumfries and Galloway and areas in between that include Tayside, Fife and Edinburgh. But we have national services too through our young people's programmes and advice and support service. We deliver services, a range of different services across Scotland. So that would include the Signature Project in Edinburgh. We support men who experience PTSD, for example. That comes out of our Stafford Centre, which is effectively an open community resource. It has counselling, it has walking groups as well, which is great. Our key delivery partner in Distress Brief Intervention, or DBI, which is connected and compassionate support for those experiencing distress. We deliver that in Highland, Dumfries and Galloway, Argyll and Bute and Western Isles. We also deliver suicide bereavement support in Highland and Argyll and Bute. We also deliver services that are close to our heritage. So that's like carer support. That's delivered in many areas across Scotland. That's offering emotional support for carers and hearing voices, which is support people with schizophrenia and psychosis. They may be hearing voices or experiencing sensory disturbances. We've got a community link worker project, or service rather, in Highland. It's a health and wellbeing service that uses social prescribing to improve people's health outcomes for those that may be experiencing stressors in their life that can lead to poor mental health. We've got employability services in Dumfries and Galloway to help people get into employment, further education, volunteer opportunities, which can improve concurrently their professional development and their mental health. So quite a broad spectrum of services that we offer, which can be early intervention prevention all the way to severe and enduring and distress. Not a crisis service, but distress brief intervention does verge on that.
Doesn't sound like much, Kieran. I think you guys need to find more things to do.
When people ask us, what do we do? It's hard to articulate it in quite a concise way,
Sure.
Which is one thing we're much better at now. But, there's pockets of stuff where we deliver different types of support. And I suppose that's what makes us really unique in a way, especially when we're supporting over 10,000 people a year.
It sounds incredibly responsive as well to the need. And I think that's where that growth and expansion happens, isn't it? When those gaps are identified really successfully with the people going through those experiences. What about mental health picture for Scotland at the moment? What does that look like? What does our mental health look like? Mental health and mental illness, people living with these conditions.
I'll start off with a fairly negative part of that, is that I think we're in a mental health crisis. It's not being appropriately funded. like I said, we're supporting over 10,000 people a year. That's a 40% increase on the previous year. Those figures are astonishing, but it goes to show the demand that there's there for mental health support. And we're not the only ones. We know other charities and organisations that are facing the same. There was SAMH CEO Billy Watson talking in the Herald a couple of weeks ago about the demand that their information service has had in the last couple of years. He mentioned about NHS24. They're experiencing more calls than ever through 111 related to mental health. We need change, we need action, we need funding to support mental health. And we sort of keep reiterating the same messages. We need more low-level, non-clinical support in the community. And I suppose it's, you look at the census data recently that came out, and more people are experiencing a mental health condition than ever before. And all you need to do is look at that, and it's doubled, more than doubled. Young people are, for the first time, most likely to be affected. We know that 75% of mental illnesses start before a person's 18th birthday. So the need for preventative support in young people has never been greater. It's key to drive forward those normalised conversations and giving young people the tools they need to improve their mental health. We do that through our young people's programmes in schools and non-educational settings. We're helping young people build resilience. They're learning more how money worries can impact mental health. We do that through a pilot which has become a service on its own called Me and Money. We're setting young people up for the future. We're teaching them about life's transitions, but we're also educating educators too. So it's a two-way street. So they know what young people are facing, the tools that they need for the future. But we're also ensuring through this work that parents and carers have that knowledge about young people's resilience too. So that's a pilot that's just come about, incredibly successful, that worked with NHS Tayside and particularly the CAMHS team there. Mm-hmm. But back to the census, like 11.3 of the population, that's about 1 in 9 people have reported a condition that's affected their mental well-being. And that's from 232,900 to 617,100. And it's the biggest rise across a range of health conditions in the census. And all you need to do is kind of look at the percentage increase from the ages of 16 to 64. I know I mentioned young people, but it goes all the way up to the ages of 64. It reaffirms the mental health crisis that we're in. I've said for a couple of years, I don't think we really hit the peak of that COVID legacy, and people are still becoming more impacted. And then you factor in like the cost of living crisis. And then there's carers as well. There's, more unpaid carers than ever before. It's a 27.5% increase. How many carers are being impacted by mental health? They're maybe looking after somebody with a mental illness. How many of them are slipping through the cracks? Some carers don't know what they're entitled to, and we're doing a big push to ensure they know what's available to them. I suppose politically, Scottish Government they've made that commitment by the end of the Parliament that 10% of frontline NHS spending is going to go on mental health. It's currently sitting at 8.5. It's going down. Audit Scotland said that the mental health services budget should be 342 million. That's frozen at 290. That's going to go down to 270. So the crisis is getting deeper. More people are getting into crisis, and that's like why we need early intervention, prevention. We need low-level non-clinical services, but there's huge demand there that's not being met. We need better mental health services, better funding investment. That's absolutely crucial for Scotland.
Let's dig a little bit deeper into that prevention and early intervention piece of the jigsaw. I was at your excellent event at Parliament a couple of weeks ago, and it was a really well-supported, very action-focused event. It felt very much about, this is what we need to do, and we know, and this is the data that we have, so we know that, and we've had these conversations, we now need more action, and we now need more going into this preventative early intervention spend. So what could or does that look like already? So you've already spoken about working in schools and with young people and with educators. What other work could be going on within that preventative space that isn't or is going on in pockets?
Yeah, that's young people's programmes was one part of that interim report, of course. And the parliamentary reception was great because a lot of partners from across Scotland, not just within mental health, but within the broader sector, came along to understand how does this cross-sector approach for early intervention and prevention work. So we've been working on that evidence base to improve that cross-sector work, and particularly in rural Scotland. So the interim report is looking at rural Scotland. It can have such a positive effect at every age and stage of life. We started with an event called Ages and Stages to sort of gather that insight from across the sector. We've gained insights from people with lived experience. It's one of our values as an organisation is lived experience, and we mean it when we say it. About 90% of the organisation at Change Mental Health who work here are driven by lived experience. They have lived experience in some way, where it comes from a family, they're a carer, they've been impacted by it themselves. But it's also, we've explored it from those who care for others or work in support of people with lived experience. The report sort of really demonstrated the benefits experienced by individuals, families, workplaces, and communities. All encompassing. Mm-hmm. Brought experts together. We've conducted interviews. We've explored service evaluation outcomes. This interim report is beefy. It's mm-hmm. It's just an interim report, and there will be a full report coming out in spring 2025. But explores some of the questions how we can improve that early intervention and prevention, something that we can give to the Scottish Government's Mental Health Division. There was a lot of appetite at that event around the interim report, as you were mentioning. We're still collating and gathering and almost still kind of asking that question to some,
sure.
Our members, for example, or other folk. We were at the SCVO's gathering the day after that Parliamentary reception, asking that same question. 120 people were in that room from across the charity sector, really engaging conversations that were had. But we're harnessing the best Scottish and global examples of cross-sector work. It's not just Scotland. Mm-hmm. And it's going to look at that sort of best practice whole system approaches. It's going to understand the sort of cultural, social, structural, financial barriers that people are facing when they access mental health support, how people are accessing those local services and support, and what can be done to extend the reach and connection. But what it's kind of doing, it's emphasising early intervention prevention that can keep people well for longer in their community. Mm-hmm. That's the crux of it. But later intervention can be more stressful for individuals. It's more expensive as well, so particularly when you're addressing mental well-being and, dare I say it, illness and crisis. Mm-hmm. But this is not us saying this is the answer, because further research and discussion is going to be needed on how to measure the effectiveness on early intervention and prevention strategies. Scottish Government policy has been helpful in supporting this general approach to mental health support and services. But budgets need to be protected, as we've been discussing. And frontline community services like what we deliver, they're making a real difference to people's lives, so reducing pressure, like our community link worker service, which talks about sort of social prescribing. But I think some of the key recommendations we have been making is sort of strengthening partnerships, expanding those prevention efforts, so kind of building on those collaborations from primary to secondary to tertiary settings. We're working with partners to identify those best practices. We're enhancing evaluation and data collection, implementing new measures to review programme impacts as well. Expanding mental health initiatives and access to support. So stuff like DBI is a big one for that as well. How do we sort of expand the referral pathways to GP surgeries, ambulance services, police? They're already doing it, but how do we enhance it even further? DBI has sort of been working with children and young people. We've been kind of working on that in Highlands, but how do we expand that pilot out to further secondary schools? And there's kind of the policy and funding commitments for that sustainability. So how do we ensure long-term funding for the likes of DBI through health boards and integrated joint boards, and developing sort of beacon projects to develop sort of best practice. So similar to our National Rural Mental Health Forum, for example.
You know that within Movement for Health, the push for preventative spend and preventative thinking and this systems-based approach is sort of exactly what we look for and what we call for and what we advocate for as well. And much of what we talk about is that a part of the puzzle for people, or a part of their experience when facing any and all long-term health conditions, should include thinking about how they move for many benefits. And I know that you and I, did we first meet in person at our conference back in I think that's when we
June.
first met in person last June, wasn't it, at the Movement for Health conference?
Yeah.
And you gave me some really excellent feedback from that in terms of, yes, great day, really felt really connected, etc. But I'd love to see more about mental health. And it is something that we see with some conditions specifically. There's a real sort of thinking, well, yes, moving more is nice. It's a nice to have, but
Yeah.
actually these people need X, Y, and Z now, and that's more important if you're looking at on a priority kind of scale. Whereas the evidence actually shows that introducing movement at any time in a person's journey with
Yeah.
any condition can really benefit and enhance their experience, and can aid their either recovery or self-management, etc., at a much faster rate. And so I'd love to sort of pick through how changed mental health feels about moving more, and what your programs are potentially that you're thinking about in that space. You already mentioned health walks or walking within
Hmm.
some of the services that you provide.
Yeah.
And I'd love to talk more about the link worker programs
Yeah.
as well. But what does movement mean for change mental health?
I mean, we've always said that we want mental health and parity with physical health, which is why I mentioned to you mentioned to you at that conference afterwards that there needs to be more discussions about mental health.
Absolutely.
But there were a lot of takeaways that day, and particularly when we're talking about cross-sector and early intervention prevention, absolutely feeds into the work that we're doing here. But I feel there's still this sort of misconception that physical health has nothing to do with mental health. It's all connected. Taking care of one helps the other. And I think when it comes to physical health and movement, we're trying to dispel the fact that it's not just like high intensity workouts,
No.
for example, on a base level. We need to think about exercise and improving physical health as encompassing other forms of movement, and those small changes that can have a real benefit to people's health and well-being. And every kind of movement is valid, and it's that individual's choice to how they make those improvements, no matter small. And looking to our services in particular, we try to incorporate that into our support across the country, and that's whether that's like our walking groups that I mentioned earlier on in Edinburgh at our Stafford Centre, our community resource there. They have a walking group as well. They have peer support groups, so they can almost work in tandem, where people are talking to someone else. They may both have PTSD, but they're talking about their coping strategies, what they do. A lot of the peer support groups at Stafford Centre, particularly within our Signature project, they are led by the people who use the service. So that's helped people get volunteer awards, for example. So they really, really sort of brought that upon their own. But I think movement can be broadened out into so many different areas. So like our carer support groups, they will do, or their resource centres, they'll do some sort of community engagement sort of sessions where they get to see local places of interest. And there's movement where you're walking, your movement where you're seeing new places, fresh air. Our employability support project in Dumfries and Galway is a photography group, and it's astounding to see the effort of photography that's put in. Like honestly, like some of the work and some of the art that's created on the back of that is incredible, and that's an example of movement, because what it's doing is it's getting people out and about. They're gaining this really keen interest in photography. They go out as groups sometimes. They will meet it completely independently of the support that they're getting, and they'll go out with one another and they'll find a place to take photography. They may have the same interest of a particular type of photography, and that helps their skills development, but they're meeting new people that are passionate about a topic which is the reason why they're there, which is photography. So that helps them with their movement. But I think broadly about movement is that like an exercise and physical health is that it has proven to reduce anxiety and depression, and stuff like a photography group can help people take their mind off it. But statistically, people with mental illness die on average 20 years younger than the general population, which can often stem from physical illnesses and preventable conditions. But there's just there's so many ways in which movement and physical health and activity can help us with our mental health. Managing stress, we can improve our moods, we can improve sleep, we can improve self-esteem. It reduces anxiety, encourages us to set goals, and achievable goals. We're meeting new people, we're slow cognitive decline. But there are barriers to movement for some people as well, which we really want to we want to remove those barriers as much as we can. We'll get onto the community link worker service and how we kind of do that, but it's good for people to set those sort of realistic expectations so they're not getting disappointed when they start movement. They find a way that works best for them. And I think we need to acknowledge our accomplishments, no matter how small. There might be struggles with movement in terms of feeling judged with what they're doing too. There's the cost aspect as well, where they think it might be too, like going to a gym is just way out of scope. It doesn't have to be a gym, it can be anything else. But I think preparation's key for this as well. There's like good nutrition, there's pacing yourself. And yeah, I think that it doesn't have to be outdoors as well. It can be indoors. There's so many different sort of community resources that are available for people to access, a lot of which are free. You can make best of free trials to find out what works best for you too. But there's also another kind of part of this as well, and I've spoken to you about this, is seasonal affective disorder, SAD, which is something that's becoming more spoken about nowadays, and thankfully is taken more seriously, because it's one of the mental health conditions where people weren't taking it too seriously. Oh, you're just sad, which is totally stigmatising. 1 in 10 people in Scotland will experience SAD, and University of Glasgow have introduced a resource called Wintering Well. It's got a bunch of stories, tips, it's got advice on how you can move more within your workplace, at home, in an educational setting, whatever it is. I think balance is key in all of this too, and we're trying to remember that rest is important as well, and to listen to your body.
You said lots of key stuff there for me, and I think just to unpick a couple of them, I love that, you already were using language like all movement is good. And people find what movement works best for them, and meeting people where they're at. And a lot of conversations that I have on this podcast and in meetings and things is around our communications, around how we talk about movement and moving more, and encouraging people to move, what that looks like. And Dr. Chloe Williamson at Edinburgh University's done a lot of amazing research in this area about what is effective messaging for people, and we were talking together about that. What is that that window of opportunity, that teachable moment where you can reach that person at that right time? What does that intervention look like, and who is it with? And I think that's really key as well, in terms of where these people are getting their support from, and what those people are sort of advocating for within that space. I love the photography example, that group. Can I ask, is it mainly men or women, or is it mixed? Do you know?
It's mixed.
It's mixed, really varied. That's excellent, because sometimes groups really struggle to be mixed, and sometimes the sort of same-sex groups are more effective. But I was thinking that this is a really good environment for a mixed group, and there is certainly some really interesting data around movement is good, movement outside is better, movement in nature is best, type of thing for your rewards, if you like. However you move is excellent. But I'm just feeling that photography group has gone straight to that sort of most advantageous setting, if they're able to get out and about with their photography, whilst either learning a new skill or simply building on a hobby that they've loved for a long time, gaining that confidence. And of course, there's that group mentality, that belonging, finding your tribe, which is so supportive in itself as a structure for people with mental illness. And I think that's really, really positive.
Hugely, yeah. I mean, I think a lot of people will come to the Employability Support Project not knowing what their hobby is, so they need to find that, or they're not like, they're encouraged, but it's gentle. It's what have you liked? What have you liked before? Is there anything that you have an interest in but you've never really taken it upon to actually do it? And I think with the photography group, the great thing is that there's no pressure for that. Like, if you go into any other group, you're like, I really have to get good at this.
Sure.
It's not like that at all. It's a total steady pace.
The goals are different.
It's the goal. The goal is what they want it to be, achievable, basically. And I've been there a few times when that photography group's on, and just watching them, like, sat at the computer but looking at their work and thinking, how can I do this better next time, or how can I enhance it right now? And the skills development's not just with the camera, it's also the software that comes with that as well. And then there's the next part of, well, how do you want to take this to the next level? Do you want to do a volunteering opportunity? Do you want to go into a work placement? What further education? What's the goal going forward? And I know one volunteer. He's been in the photography group now. He sort of leads the photography group as a volunteer, and he studied at, I think it was the Cumbria Institute of Arts. So he had that sort of art background, and that he can use that knowledge in that photography group as well. Give service users the tips from his knowledge, and he can give advice. And he's become a volunteer with us, and he's set up virtual exhibitions as well. So it goes to show what you can do with that as well. You can become that volunteer or one further. It's entirely up to that individual what they want to do.
And I'm imagining that gives that individual a real sense of achievement. It's a huge achievement, but I'm hopeful that they know that that's a big achievement, and that's they get that reciprocity from it as well. I spoke there about who you get your messages from and your advocacy, and you've mentioned social prescribing and the link worker program. I'd love to explore that a little bit more with you guys at Change. I was delighted that you'd continuing to deliver the enormous piece of work that is your link worker program. And I have been sort of talking with link workers, social prescribing network, etc. in Scotland for the last couple of years about where movement sits, where physical activity sits, where within their frameworks, and how they deliver their services to individuals. And it's been a real privilege to kind of understand that better, and see a real such a key workforce at play has been really fantastic. Also managed to speak to quite a few general practitioners and people that would be absolutely lost, in their own words, should their link worker not exist anymore in that space, seeing them as a real crucial linchpin to be able to take the hand of someone literally and guide them to X, Y, and Z, and really that very holistic, person-centered, focused approach. Tell me more about your program at Change and what that looks like.
Yeah, so we've been delivering community link worker service since July 2021, supporting adults over the age of 18 across communities. We're working in 62 GP surgeries, from Caithness to Lough, and we've got rural communities such as West Sutherland, Skye and Lacouch, and the Small Isles. What we're fundamentally doing is we're improving health outcomes for people experiencing stressors in their life due to social problems. That can lead to poor mental health, but the referral does come from the GP, and I think the social prescribing is an interesting one because it's a term that not a lot of people know, and that's unfortunate about it as well. A lot of people refer to it as social prescribing. People may know it as a community link worker. And it's sometimes known as a community referral, which I think would be a bit more of an accessible term, but for the sake of clarity, it's the means of enabling health professionals to refer to a range of local and non-clinical services. Now, it can be national services. Again, it's what works best for that person. But we're quite fortunate to have forged some very strong links in the community that we are working from. Our community link workers have created a live resource directory of support networks that can help people who are referred to us. And it means that we can refer to services quickly. But that also helps us identify what's missing from the community as well. So we can seek to try and broaden that out. So it's kind of, we build this up so that the voices of the community are heard too. But it's entirely person-centered in its approach. We're getting to know the person, we're getting to know their interests, their likes and their dislikes, we're shaping the support around them, and we're socially prescribing them to an activity that suits them best. But it's about accessibility. Again, that's a very key word within this, is accessibility. And it's not just in terms of the social prescribing term, it's also delivering the service in each client's locality to minimise travel. Now, we know the issues that rural communities face, and I'm sure we'll talk about that more broadly, because that's a big topic, is rural mental health. But we're offering individuals a choice of locations to meet. We think it's really important that support is accessible. and we're assessing whether, the activities that we're offering are totally tailored to that individual's needs. We're in conversation with them to make sure that that is accessible to them, whether they're free to attend. If not, how can we cover those costs and find ways to do that? We're looking to promote people's ability to self-manage their health, but we also do focus on stuff like intersectionality as well. Clients who may have protected characteristics and complex issues to groups and organisations that represent their needs and offer that sense of belonging. Back to what you're saying, like that sense of belonging is really important. It is covered over about 8 sessions, so it's up to 8 sessions. We're formulating that plan of action. There's a sense of achievement. There's confidence to reach goals. We're reviewing those goals, outcomes and priorities after each session. We're ensuring that they'll engage with the activity or service. We do see people go to movement-related activities such as walking groups, exercise classes, or even skills development. But we've identified that there's like complex socio-economic factors that have a direct impact on physical and mental health. So that can be loneliness and isolation, poor environment, poor social connections, and these ultimately do result in severe negative health outcomes. But we do work with, people who have poor mental health, housing, discrimination, and more. But we know by addressing these socio-economic factors and tackling health inequalities, by taking an approach that wholly meets the needs of the individual, we can achieve more positive outcomes and help overcome barriers. But it's recently been expanded to the 62 GP surgeries in July 2024. Last financial year, 2023 to 24, we supported 851 people across Highlands through the Community Link Worker Service. But that impact will only get greater now that it's been more than doubled. We've seen between 2022 and 2024, nearly 3,000 referrals, nearly 10,000 appointments, nearly 5,000 social prescriptions. So it's very, very active. And we had a really good BBC piece that went out in August. Don't know if you've seen it, but it was incredible to sort of, make that social prescribing term more accessible and, speak to the Highland community and say this is out there. But it was a national piece. So Community Link Worker, that happens around the country. There are some areas where funding has been pulled, sadly. But every GP surgery needs a Community Link Worker, because this BBC piece spotlighted a woman who she felt so low. She had troubles with housing, thought she was going to get evicted, and she lost motivation to do anything, really. But her sanctuary was collecting sea glass in Invergordon, and that was her idea of movement and getting out there. And she does stuff with the sea glass. She creates stuff on the back of it. So the Community Link Worker effectively referred her to relevant services, spoke to the relevant departments to try and sort out our housing situation, to sort of ease the load of our housing issues that were creating problems with her mental health, and reiterated that she needs to make time for herself. And that's the sea glass, and that's any hobbies that she had, and that's been transformational for her. So the impact is huge of Community Link Worker, and as you say, it's reducing that the waiting lists within GP surgeries, and yeah, it's just the GPs are they are singing its praises across Highlands. I think some of them didn't realise how transformational it was actually going to be, and now they're realising how important it is to them and the GP surgery. And it is thanks to NHS Highland that we get the opportunity to do that. So it's an incredible service for us, and it's just been nominated for Best Wellbeing Service at the Mental Health and Wellbeing Awards Scotland. That's taking part this Friday, which will be, fingers crossed. Let's see what happens.
Good luck with that. Thank you for sharing that story with us about the lady with the sea glass as well. And I know that people can still see that on BBC iPlayer on Catch Up. I remember it was a very powerful piece. And what I like about that example, that story, is it shows how we need to be able to lift some of these life pressures, that individual's housing scenario, loneliness, the isolation and everything else. That person needed a chance to breathe, to be themselves, to not have to live in fear, constant panic, worry, anxiety, from the day to day. That enormous toll that person will have been under mentally cannot be underestimated. And I think something that I reflect on is these stories with the link workers around those relationships that they have with people, and what they're able to bring with. I think from the outside world, it might feel quite, what's the right word? It's a delicate touch sometimes as well. It's very nuanced. It's maybe not loud and big, and there's a big intervention. And I think maybe that's why, if we can't measure it in certain ways, it doesn't count necessarily as a profession, as a thing. And I really think that evidence and those stories are now cutting through that noise and misunderstanding of what social prescribing, what link workers do, and that key relationship that they have with GPs as well, and clinical staff, as well as the patients and the communities. So I think that's you've put that really well. Thank you. And yeah, best of luck on Friday. I'm sure we'll see you on socials. My fingers crossed for you. You touched there on rural mental health.
Yeah.
And I can't remember what Miss Todd told us to call it instead of rural at your event, but she said something and I've completely forgotten the word.
You can't call it remote.
Remote, that's right.
People say rural and remote. It's just rural.
It's just rural. It's just rural. So we can use rural still. Fine. I'll use rural. And yes, rural mental health. So I was at an event around transport poverty last year, and we have been doing some work with Public Health Scotland's transport poverty programme, looking into that and trying to understand that more from a movement perspective, from being able to connect people to services and groups and activities and places, physical places and spaces for them to move. Yeah. And I know that you guys are incredibly involved with the Rural Mental Health Partnership and the forum. And tell me more about that work and what that looks like. What does that look at specifically?
Sure, yeah. So we have quite a speciality in rural mental health. Now, we're not a rural mental health charity. We are a mental health charity, but this all kind of stemmed from the Rural Mental Health Survey, which was research that occurred in 2017, finding how there's a lot of unique stressors that will face rural communities in Scotland that contribute to poor mental health. So 80% of the support we deliver is across rural Scotland. So it's quite a number. And we lead on the National Rural Mental Health Forum, as you said, which is a movement that's been key in the mental health and wellbeing strategy, improving people's mental health across rural Scotland. It's working in partnership. It's delivering seminars with individuals and organisations across rural Scotland to influence policy, change lives, ensure that voices are heard. Nearly 300 organisations are members of the forum, probably yourself as well. And, we get over 100 people from different organisations attending these seminars, and they create a real talking point how we can improve rural mental health together. And we've been really lucky to have organisations like See Me, the Scottish Government, and they're going to be talking about their New Islands plan coming up, Breathing Space, talking about the impact that they have across rural Scotland and their really vital helpline. And we encourage folk to be part of the strong, dedicated network. Helps us drive change, and it enables rural people to be more open about their mental health. But I think there's a big misconception around rural mental health. There's a lot of stigma, there's a lot of myths in what can be some of the most isolated and lonely regions across the country. Now, urban Scotland does experience these challenges, don't get me wrong, but rural Scotland is particularly unique. And there's that definition of what rural is. It's classified of places that are population less than 3,000 people. 98% of Scotland's land area is deemed rural, despite having 17% of the Scotland's population. It can impact so many people. But that you were talking about some of the unique challenges, and there is that lack of access to support services that's heightened by poor digital connectivity, inadequate transport links, lack of anonymity. Many who access our services, particularly through a community link worker service, they'll experience these challenges and they'll come to us with those concerns and we will address them. I mean, it can have its benefits. There's that research that shows it's a slower pace of life, less crowded environments that can contribute to reduced stress levels. There's that connection to nature that promotes relaxation. Movement's a big part of all of this as well. But when we look at the challenges through a lens, there's less mental health resources. That means there's less professionals, there's less access to clinics and hospitals. It makes seeking assistance more difficult if you consider the challenges of recruitment and retention of staff in rural areas and statutory services. But when there is access to services, they can be quite a few miles out. So therefore, it's hard to actually get to these services, particularly if you don't drive, particularly if you are struggling with money. There's a lot of issues that can happen if there is that access. And we know that very well. Again, there needs to be low-level and non-clinical person-centered support on people's doorsteps and in the high street, focusing on early intervention and prevention, so people have an access to support that they need when they need it. But rural areas do offer that sort of strong sense of community, which can be very positive. But in a close-knit environment, they can be quite isolated for individuals who are not well connected within the community, and that poor digital infrastructure, it can make keeping in touch with family and friends even harder.
Yeah, and I'm wondering about stigma of mental illness as well in where small communities are so close knit.
Yeah.
And I do wonder about people maybe feeling a little bit stigmatized, maybe more so, or maybe they just feel that a bigger spotlight on them, perhaps in a smaller community. Then you can get a bit lost in the crowd in towns and cities. The digital poverty stuff I think is really interesting as well, because you mentioned COVID earlier. For movement, for many, we saw this influx of online availability of free resources and things for people to access if you're living with X, Y, and Z. And a lot of our member organisations moved online for a lot of the services that they were providing to great success in a lot of places. However, we had that digital poverty problem for so many. And if we're looking at inequalities, it's when we add to inequalities with some of the decisions that we make as organisations as well, without maybe taking that into consideration in terms of the digital poverty, the transport poverty, it isn't a case of make it and they will come. It isn't always that easy for people, is it?
Well, there's the digital exclusion factor is kind of twofold. There's the connectivity, but then there's the skills to be able to use the digital as well. I used to work in the disability sector, and that was a big thing, particularly around COVID times when you had the Connecting Scotland Fund, enabling people to have access to technology. And the argument was always, well, that's great. They're given technology, but they know how to use it. And particularly during COVID times, they couldn't get taught. Some people don't know how to use computers, tablets, phones at a base level. So it was always a barrier as well. But you mentioned in that the lack of anonymity. There's one example that came to my head was when I first started at Change Mental Health 3 years ago. I went around the services. This was around the time we were rebranding. And the one thing that I think it was a senior project worker told me is, and this was in a small town in Dumfries and Galloway where we had a building right on the high street, and she said, some people will come to the door, but they won't come in because they don't want to be seen going into mental health services. They fear they're going to be judged in their community, and they would actually walk away. They wouldn't turn up for groups, or they wouldn't turn up for appointments, or they would spend 10 minutes around the corner deliberating whether they should go in or not, which is really sad when you think about that. But I think the stigma is a massive thing in these communities as well. But I think the great thing now around rural mental health is more people are talking about it, and that's thanks to charities like RSABI as well, particularly from the farming community. Keep talking, I believe, is their slogan. So more people are talking about it now, and it is thanks to networks like the National Rural Mental Health Forum, which are enabling people to talk about it more. And I think another issue for rural communities is there's fewer recreational activities. While we're saying it's great for nature and everything like that, there's limited opportunities for social engagement and personal growth. And that's why we run an employability support project there. And these rural areas often have lowest wage economies as well. It means there's less job opportunities that can contribute to more financial stress and job-related mental health challenges. And at a time when burnout is something that people are talking about more, that's even worse. Our partners, Mental Health UK, they released their second burnout report, and it said that 91% of adults in Scotland have experienced high or extreme levels of stress and pressure in the last year, which is higher than any other UK nation. And nearly 1 in 4 people in Scotland take time off due to poor mental health caused by stress. So that is a big issue, and the financial stress aspect as well is a reason why we run an advice and support service. So it's an accessible way in which people can get in touch with us for support with their mental health and money worries. People can get support with their mental health wherever they are in urban or rural Scotland.
Thank you. I wonder how access plays a key part in this as well. We have wonderful individual Alec Finlay, who is the artist in residence at Paths for All, and he runs something called the Day of Access. He works with a lot of very ill people, and who who describe themselves as quite minor movers in various ways, a lot of chronic pain and chronic lethargy conditions, very, very isolated, and are still shielding from COVID and things as well. Obviously, massive mental health strains within that community too. And he has I don't know for how many years it's run, but the Day of Access is about supporting people to get to those places that people that don't live with those conditions get to. So about organising these amazingly purpose-built jeeps and things to go up the top of mountains and have access to places that they wouldn't be able to get to. It's 1 day a year, and I just sort of think, oh, that would be great if it was more than one. We take some things for granted so much. I was up the mountains in half term recently, and I was reflecting on how lucky and privileged I was just to be able to go for a big hike up Nevis. It was great. But so many can't do that, and therefore can't get the benefits that those things can bring.
Yeah, absolutely. I used to work for a disabled access charity where they were kind of like a trip advisor for disabled people, and they allowed, it was user generated, they allowed people to leave reviews on what the accessibility was like from the toilets to getting in to ordering food, and
like a Craigslist type of thing.
Kind of, it kind of helped people know where the good places were for access, where the bad places were for access. And I suppose we haven't really talked about the sort of long-term health conditions in people who come to our services. We spoke about physical health and mental health, and I just think about Duncan Galloway, and I remember speaking to someone who had EUPD, but also had OCPD and some other long-term health conditions, and she found a battle trying to get to that service, and which was fairly remote, and she could drive, but not when she had problems with her physical health. So that's also it's having these accessible support avenues near you is better, and in rural communities, if you are facing long-term health conditions and physical health, it's just really challenging to get support. And again, it comes back to the whole digital divide. It seems to go in a bit of a spiral, and we need to figure out a way in which we can make it easier for people to access support when they need it and where they need it.
We do. To finish us off then, Kieran, what can we expect to see from Change Mental Health in the future? Irons in the fire? Any more expansion plans, or what are you going to be focused on?
We're working on the early intervention prevention stuff, which will be, the full report will be released in spring, and we'll be looking to kind of capitalise on that. We're at the end of a strategic period, so we'll be hopefully launching a new strategy in the start of next year. So it's a lot of busy times with we're moving a couple of buildings to make them more accessible for people to access and support, particularly one in Dumfries at the moment. That's a busy time too, but we're thinking about accessibility broadly and about how people can get access to mental health support. So we're looking at our digital presence and how our website can be a bit more user-friendly in terms of people finding out more about mental health conditions, mental health resources, access and support, access and advice and support service, signposting to other services. So that's one big sort of project for us this year. It's a bit of a kind of development year towards that new strategic period that we have. As ever, we are a very critical friend to the government, and we're always talking to decision makers and local authorities as well. Funding's a big thing too. We want to keep that going. But we're active for the Labour conference this weekend and many other political conferences too. So it's really just continuing that partnership. We massively believe in partnership, and we want to cultivate even better relationships with partners going forward. So yeah, another busy year. It feels like the start of the year has kind of flown by, and it's already nearly March. But it's exciting work, and it is really. I've mentioned the word accessibility so many times during this podcast, but that is actually, I think, the key word for us this year, and we're looking to sort of upscale our mental health training as well and make it again more accessible for people, more digestible for people going forward. So, really exciting times and a lot on, and of course we will be at the Movement for Health conference this year as well. So we look forward to supporting with that.
Excellent. Just for the listeners, we're not doing a conference this year. So please don't turn up. We are doing something else, though. We are doing something else, and you will be very involved in that too. And I have just, as a partner, I'm going to call myself a partner with Change Mental Health. It's just been a real privilege for me to get to know your organisation and to see a real partnership organisation at play. I think an excellent example when we're so lucky to have you in Scotland doing this work, and and really pleased that you've come on board with the Movement for Health Coalition. I think there's a lot more we can do within the mental health, mental illness space with regards to movement more, excuse me, and that equity and equality of movement, which I think is really key. And you've touched on many of those points with me this morning. Thank you for your time, Kieran, and thank you for listening to today's Movement in Conversations podcast. Thanks to Kieran, thanks to Change Mental Health, and we hope this helps to support your movement for health. Bye-bye until next time.
Thank you.